My name is Dr. Mark Pomper, and I'm the medical director at the CyberKnife Center of Miami.
Dr. Pomper, why would you tell people to choose the CyberKnife Center of Miami to go for radiation therapy?
Well, first of all, CyberKnife is the most sophisticated and refined way to treat most tumors, and therefore patients can get their tumors hopefully cured in the most efficient manner and with the least possible side effects.
And what about in terms of your staff? Experienced, one of the first in South Florida, if not the first center in South Florida.
One of the most frequent comments I get from the patients I see is that they love our staff. Our staff is knowledgeable and courteous and really a tremendous resource.
Do you hear people often say they start out very frightened and then their fears are eased?
Absolutely. I mean, anybody, when they hear the word radiation, they usually think of Hiroshima and Nagasaki.
It's my understanding that one of the things at this center, you put patients first.
Absolutely.
Tell me your thoughts about patients and their being a priority.
They're number one, number two, and number three. That's what we're here for, is for the patients.
What would you say to somebody who was considering radiation therapy versus surgery, and one doctor says surgery and the other doctor says radiation therapy? What would you advise a patient?
I would tell them, listen, the surgery in most cases is also very effective, but you have to look at the risks and talk to people who've had the treatments. Because a lot of times the doctors, especially the surgeons, they minimize the side effects or the complications, but they're certainly, from a patient's point of view, these are very significant.
If somebody is uncertain, can they come here and talk to the staff and the doctors here?
I encourage that all the time. I encourage that patients don't have to get CyberKnife who come here, but if they want to get an opinion and learn more about it, they should come.
Is there anything in particular you want to say that a message you'd like to send to people?
Well, if anything, I think it's that people are really unaware of what we do. Most of the patients we get are more sophisticated in terms of checking things on the internet, and they often ask me why they weren't told about it. And I think part of it is just really education of the doctors in general. They think a patient has cancer and they just send them to a general radiation center, and they do the best they can with what they have, but they don't have this machine.
Why do you think prostate cancer, I would think that every prostate cancer patient who would have the opportunity to do CyberKnife should be doing it. Why are not all men who can do radiation therapy for prostate cancer not doing CyberKnife?
I think that most of them don't have the option. They just don't know about it.
So be your own patient advocate. Ask, ask, ask.
Yes, for sure.